If you have any questions, throw them in the chat as we go along, and we'll reach out. I am going to record the session so that we could always replay it, and whoever missed, or we have some international people that always miss the time zone, so then they can go back and watch it. We have Jasmine Pizer. She is the Neuropsychology Fellow from Cincinnati Children's Hospital. She currently works with individuals with SDS through, I guess, the Cincinnati Children and the Division of Bone Marrow Transplantation. She completed her graduate training at the University of South Alabama and her pre-doctoral at the University of New Mexico. So welcome. Nice to see a new face too.
Thank you. Yeah, thank you for introducing me. I'm so glad that y'all invited me to come talk about neuropsychology. I think the foundation a few times has had neuropsychologists on to talk about neuropsychology and what it is and what it involves. So I'm going to go into a little bit about that. But yeah, feel free to be asking questions in the chat, and hopefully I can answer some of your questions. So yeah, I'm a fellow at Cincinnati Children's in the neuropsychology field, and we partner with the providers, physicians who see kiddos with SDS. We do all the neuropsychological evaluations for those kiddos. So that's right now how I work with that population. And so most people have never heard of neuropsychology. It's this long word, and it's not really in the common vernacular of things people talk about. But if you break it down, it's really just neuro and psych, so meaning brain and behavior. So that's really what we specialize in, and what we look at is just that study of the brain and our behavior. It's technically everyone who's a neuropsychologist is first and foremost a clinical psychologist. So we're psychologists first, and we just specialize in neuropsychology. So underlying brain conditions and medical conditions like SDS. So what do we do? So the main role that neuropsychologists have in medical teams is evaluations. So really, we like to think about the brain and how different parts of our brain are responsible for different things that we do, different skills that we have. So you can see in this picture there's different kind of areas of the brain, different lobes, different parts, and they're all technically responsible for different things that we do. So you can see in that front area of our brain, it's really responsible for attention and organization, whereas the back and the bottom of our brain, it's, what we see, how we use our muscles. And so we do evaluations to kind of see all the different parts of our brain and how that is coming out in our behavior and what it really looks like in our day to day. So what I like to tell my patients is we're getting a picture of your brain and how it works without actually taking a picture like an MRI. So some things to point out about what neuropsychologists do not do is we do not prescribe medications. So that's sometimes something that people think we might do, but we do not prescribe medications. We also are not typically involved in treatment like therapies or mental health therapy, behavioral therapy. We can be, we have that training, but usually what we do is we provide the evaluation, that start point, and then give you good recommendations and referrals on what's going to be the best next steps in terms of treatment. So a really good start point. And then we assess all these different areas through our evaluation. So we look at overall intellectual functioning, so what most people call IQ. We also look at different academic skills like reading and writing and math. And then we look at people's ability to use and understand language, how people make sense of visual information, people's ability to pay
Raji,
attention and
volume கம்மி
focus,
பண்ணேன்.
people's ability to process information quickly, how they learn and remember new information, and then planning and organization and completing tasks. So we also, and that might sound like a lot already, but in addition, we also look at emotion and behavior and social skills as well as daily living skills. So how are they doing with completing chores and doing their own hygiene tasks? All those kinds of things that we need as we get older and older. So why are we kind of here today talking about neuropsychology? And why do neuropsychologists work with patients with SDS? So it's important to know that most patients with SDS have differences in the SBDS gene. So kind of going really biological with y'all. But this gene, which results in SDS, is it shows up in all the different tissues of our body, many different tissues of our body, and that includes our brain tissue. So because this gene shows up in the brain tissue, we want to make sure that we're tracking brain development and brain functioning. And then also because a lot of people with SDS get bone marrow transplants, we also want to do these types of evaluations because that type of transplant, while it's life-saving and amazing, can also have an effect on our thinking skills. So because we know these different things about SDS, we know that this population is at higher risk for things like developmental delays and learning difficulties. This can include learning disabilities, ADHD, behavior issues. And while that's not something that we see all the time for people with SDS, because it's at a higher risk, we want to make sure that we're continuing to keep track of their development, their functioning, so that just in case there is any need for some extra help and support, that we can get in there and provide that extra help and support before it gets to be, detrimental or really, really interfering in their life. So when you come in for a neuropsychological evaluation, it typically includes 4 different parts of a process. And this can sometimes happen over several days. It can happen all in one day. But I'll walk you through what this looks like. So the first step is really an interview to learn about the patient's medical, academic, psychosocial, and family history. So this looks very similar to like your very first appointment with any physician or doctor that you meet with. We sit down with you, we get to know you, get to know if it's your child, then getting to know your child, getting to know your history and important information that'll give us some ideas of what might be really nice strengths for your kiddo and really nice ways that we can be there to support them. Then after the interview, we do testing, which is kind of the look at all those different areas that I was talking about before. And this really looks at like sitting down one-on-one with the patient with SDS and doing a lot of different activities that assess those thinking skills. So A lot of times, kiddos will say it looks like a day at school without all the other kids, so just a one-on-one time with kind of a teacher. I personally think it's more fun than school because a lot of our tests don't look like tests. It's like working with blocks or doing word games, different things like that. And then following that testing, we kind of sit down, we look at all the test results, we look at the interview, and we pull all that information together. So that way we can all come together as a team to discuss the results and provide you feedback on the information of the results, come up with any diagnoses that they might meet criteria for, and then provide recommendations for next steps. And then, based on all that information, there is a written report that is provided to the family. So, this describes all those results and recommendations, and it is given to the family so that they can keep it for their records. But it is also recommended to the family that they share that report with either the school or other physicians and providers that are a part of that patient's medical team. That way, it's kind of an all-encompassing report and recommendations that can be given out throughout the whole medical team. And you can see here too that I provided different kind of lengths of time each of these steps typically take. But it is important to note that depending on where you go, this may look very different. So sometimes the interview could only be an hour long, sometimes it could be 2 hours long. Sometimes testing can be as short as 3 hours, or sometimes it could be a full day. So it really just depends on kind of the site and what the typical day looks like based on that site and that neuropsychologist. Okay, so why do we do this evaluation? What is the purpose of it? Can it provide answers for? So the reason this evaluation can be helpful is that it's really to see whether a child's medical condition like SDS or treatment that they received like a bone marrow transplant is having some kind of impact on that patient's thinking skills, their mood, their behavior, keeping track of that development so that we can intervene if needed. And we use standardized norm reference tests and questionnaires in order to compare the patient or your child to other children their age. So these are tests that have been done with thousands of different people to get a look at kind of where typically developing children fall in all these different areas. And so that one score that your kiddo gives is compared to the score that's normal for that age range, and we see how they're falling based on that normal development. So that way we can provide, okay, this isn't quite going how we would expect it to go for a kiddo that age, so let's intervene here. Or we can say things like, wow, this is a really great strength for your kiddo. They're doing even better than most kids their age. Let's make sure that we use this strength to overcome any difficulties that they might be having. So we can identify those strengths and difficulties, areas where your child might be having more difficulty than other kiddos their age, and ways to support your child's development. So like I said, providing those recommendations on interventions and treatment that can be helpful going forward. So the next question that we get a lot is kind of, when is a neuropsychological evaluation needed? When can it be helpful? What are times where I should be going in and getting this neuropsych evaluation? So we typically recommend that children with SDS receive a neuropsych evaluation every 2 to 3 years, really to monitor that brain development and make sure that they're receiving the services that they need. So it's it can be helpful to have these evaluations during key developmental transition points for the kid, like prior to entering school or right when they enter school, in about that mid elementary point. So there's this point at about third, fourth grade where kids transition from learning how to read to reading to learn new information. So that's a really key transition point and a time where we get lots of kiddos for neuropsych evaluations. And then we like to see them at other transition points. So right when they're getting into middle school, right when they're getting into high school, and then early adulthood. Other times that an evaluation can, so those are kind of like typical key points that we like to see kiddos in their development. But there are some other key times where we might want to see an evaluation if we haven't already, or if it's not already on our schedule. So if that kiddo gets a bone marrow transplant, we definitely want to see them probably about a year after they've had that transplant, just to kind of see if anything has come up following that transplant and if there's any extra services or needs that they might be having following that service and treatment. If your kiddo starts having seizures or a head injury, some really big change to their brain functioning, that's a good time when we want to see them. And then also, just if there's increased difficulties day to day at school or at home, so all of a sudden we're getting lots of parent teacher conferences that are needed where the teacher's saying we just can't handle this behavior, or at home we're having lots of behavior disruptions and increased difficulties, that's also a really nice time to get a neuropsych evaluation. All right, so now that we've kind of gone through what a neuropsychologist is, what do we do, what an evaluation looks like, the next step would be, how do I find a neuropsychologist if you're not already connected with one? So a good place to start is just by talking with your primary care provider, or your child's primary care provider, like their pediatrician. You can also ask their specialized medical team if they see someone specifically for their SDS. They'll probably know how to refer you to a neuropsychologist. Some other ways to find neuropsychologists is at your local children's hospital. Most children's hospitals have at least one neuropsychologist or a general psychologist who provides clinical evaluations. And then all major children's hospitals like Cincinnati Children's Hospital, where I work, or, Boston Children's, or Texas Children's, those different children's hospitals will have a neuropsychology team. If none of those are really near you or make sense for you, a good online directory is the American Academy of Clinical Neuropsychology. So you can actually look on there where your closest neuropsychologist would be. So there are plenty of neuropsychologists that are outside of hospitals, like at private practices. Okay. So something else that maybe your child has already done without even knowing what neuropsychology is an educational evaluation through the school. So if you have concerns about your child's academic skills or performance, I really recommend talking to their teacher about steps you can take. And you can submit a request for your child to be evaluated for an educational plan, like what we call an IEP, or an individualized education program, or a Section 504 plan. So that's if they don't already have those in place, you can request a meeting to have that evaluation to see if they meet criteria for those different plans and programs. You can also request a meeting to update those plans and programs. If they did get a neuropsych evaluation and something new came up, it can be helpful to get an updated plan based on the results of that evaluation. So some children with SDS really benefit from classroom accommodations to support their attention and learning, like things like preferential seating or extended time, reduced assignments. Those all come kind of out of these IEPs or 504 plans. That's how they can get access to those services if someone's not already providing that extra help. And then some children with SDS also require specialized instruction or support from an intervention specialist. And that's usually what comes out of an IEP. So if you can't access a neuropsychologist, or maybe you did get a neuropsychological evaluation and we have recommended these things, this is the next step to move on to, is talking with that school team, talking about what they meet eligibility for extra support at school. If these are things that you've never heard of or you're wanting more information on them, a good resource is this website called Rights Law. This has all different information about 504 plans and IEPs, and then also looking through your state's Department of Special Education. That's a helpful resource to see, what your specific state laws have on requiring these evaluations or this support at school. And then another place to, a good place to start, or something that might come out of a neuropsychological evaluation, is, if your child or if someone with SDS is having difficulties with emotional, behavioral, and social functioning. So again, a really good place to start is to talk to your primary care provider or pediatrician. They can get you in contact with a clinical psychologist or a therapist, counselor, and you can also consider therapy. This way you can discuss concerns and see if therapy might be helpful based on some kind of consultation, and consider individual or family-based therapy. If you're not sure about talking with your pediatrician, or if your pediatrician doesn't quite know where to start, an okay resource is looking at Psychology Today. They have a nice a search engine where you can put in your location, you can put in your insurance, you can put in if you'd like it to be telehealth sessions versus in-person sessions, and it'll come up with providers that meet those different search criterias. Okay, so these are some things that I've included on kind of recommendations that I really give to most of the kiddos that I see, and might be helpful to start without even, before even moving forward with a neuropsychological evaluation. So things that you can do right now. So if your kiddo or someone you know with SDS has attention skill difficulties, so difficulties remaining focused, difficulties with organization, staying on top of things, these are some really good resources. So the website Children and Adults with Attention Deficit Hyperactivity Disorder, or CHAD, is a really nice resource. Your kid does not have to have ADHD to get benefit from the resources that are on that website. They just provide a lot of really nice tips or tricks for how to manage different difficulties with attention skills. There's also the Smart But Scattered book series for all different kiddos of all different ages and adults. That also has some nice tips and tricks, especially for parenting and how we can kind of learn those organization skills, planning skills, making sure that we're kind of on track. So that keyword of being scattered, even if we've got all those smart skills, but we're having trouble pulling it all together to maintain our organization and focus. There's also the Center on the Developing Child with Harvard University. There's some really nice resources if you just Google that resource. There's different how-to guides and step-by-step information on how to work on different skills that can be helpful. And then I've also included an app since lots of kids and teens like to use apps. There's an app called the Focus Friend, which is a productivity timer. It's a free app and it kind of shuts that kiddo's phone down for a period of time while this little focus friend of theirs is knitting a scarf. And you really don't want to interrupt your productivity timer because then your scarf goes away and you haven't created your scarf. So the longer that you're productive and have that app up that shuts down the rest of your phone, the more you can create and earn with this app. So that's a really nice free resource. Okay, and then some resources for social skills. So again, whether or not your kiddo has autism or not, these are really nice resources for learning social skills, how to approach new social situations. So this book, The New Social Storybook, provides all different kinds of social stories that helps kids prepare for new, maybe scary situations and how we can behave in those situations or what might be most helpful and safe for us to do in those situations. And then there are also these two websites, socialthinking.com and autismspeaks.org, which again has some really helpful resources. All right, another thing that we can do to help our kids right now is teaching relaxation skills at home. So again, if your child has anxiety or if they don't have anxiety, these are very helpful resources for all kiddos. So there's a website called Mayo Clinic Anxiety Coach that can really walk a kiddo through how to get over specific fears like social fears or any worries that might be coming up. And then there's lots of nice resources on YouTube. These are the ones that I recommend that are, more evidence-based. So there's these resources through Johns Hopkins, how to do deep breathing and guided imagery. So these might be things that we've heard or things that we sometimes think about with relaxation. But these resources are nice in that they provide step-by-step evidence-based practice on how we do, deep breathing or guided imagery in a way that truly calms our body down. And then there's also progressive muscle relaxation, so same thing. And then there's this calming strategies for kids, mental health literacy. That's really nice resource, especially for younger kiddos, where we're doing those skills that are in those John Hopkins resources that are listed above, but they're a little bit more fun. So instead of progressive muscle relaxation, we're doing something like squeezing lemons. So squeezing them really, really tight and then letting the juice go and letting it calm down. Or we're doing cookie breathings instead of deep breathing, where we're smelling in the cookie because it smells really nice and then blowing on the cookie because it's too hot to eat quite yet. So just some nice fun ways to incorporate relaxation skills for your kiddo at home. All right, another thing that I recommend to everybody, no matter what's going on in their day to day, is sleep hygiene. So we know sleep hygiene routines can be helpful for improving sleep quantity and quality, and sleep is so important for our brain development, maintaining healthy habits, keeping on top of things, attention. It's really just an amazing way to give our brain a little bit of love. And it's also one of the things that can be most difficult for kids and adults. So, some helpful things is first to know how much sleep your kiddo or you should be getting. The next is to keep a really consistent sleep schedule. Go to sleep and get up around the same time every day, which can be very difficult, especially if our routine and our daily activities change day to day, but can be very important to try and keep on top of that as much as possible. We want to try and avoid naps during the day because that can make it hard to fall asleep at night later. We want to have a relaxing routine that leads up to bedtime so that our kiddo starts feeling sleepy as we lead up to bedtime. And that includes avoiding screens, eating, drinking, or other activities close to bedtime or in bed. So keeping that bed for sleep. And I've just included two websites that can be really helpful for getting on top of sleep hygiene and different resources about it. All right, something else that I talk to all my patients about is medical responsibility. So, really, especially if our kiddos, 12 or older or even younger, there's really no time that's too soon to start step by step letting our kiddo take more responsibility of knowing medical information and teaming up with the medical team. Um, Especially when we have a kiddo with SDS, a medical condition that we'll be living with our whole life. We want them to start taking independence for knowing the information that affects their life. So they know that they're part of their treatment. They know that they're part of helping them stay better and keep on top of things. So, a nice thing to do is just to work with your medical team to learn strategies to take more medical responsibility. And so this kind of includes, making sure that your kiddo starts learning the names of the medications that they take, or at least know how to keep track of that. So, whatever you might be doing can also help out with your kid learning how they'll eventually do it when it's their turn to take responsibility for it. So, like having a note on their phone or having it written down, using external aids like alarms or a pill box, starting to teach your kiddo how to use those different things. Creating consistent routines like linking medication taking with other daily tasks. So, like brushing our teeth, if that's how you kind of link your daily routine with taking medication, starting to teach your kiddo how to do that. Maybe keeping the pill bottle right next to the toothpaste, that kind of thing. Keeping medications in consistent locations, it's in the same place every time. And then also teaching them how to problem solve with you and with their medical team on making medical decisions. So I know, especially if you have a young kiddo, these are things that feel super far away, but it's never too early to start teaching your kid how to do these things. And then my last resource that I wanted to provide is this book that's called Steps to Independence. So, this is especially helpful for kiddos who have special needs or any kind of difficulties day to day and kind of taking control and independence and skills. It's a really nice book in how we can start scaffolding those responsibilities to our kiddos when they have difficulties with those things. All right, and that is really all that I had for the presentation today. Hopefully, I provided some new information or helpful information on some things, but please feel free to ask me any questions about things I didn't get to or talk about, or if there's a question that y'all had that just came up in general with the presentation.
So you guys can either raise your hand or type it in the chat. Jasmine, I did a put it in the chat, but I'll say what it was in one thing. Matt had my son's 21 now. He had an evaluation when he was in middle school, and we know there are some higher level executive functioning issues. He did he has great memory, so we don't have any problem. We didn't have any problems till later in not even problems. It was a little bit harder for him and later in high school
Mhm.
when you can't memorize everything. But he straight A's, Dean's List, so we didn't have any issues with there. So, you know, when the school sees that, it's harder. But uh, there is still some issues. I know there's anxiety. He has this what I call it like a twitch now. When he gets really anxious, he tenses up and his hands go and his face goes. And I'm, a little worried for when he gets out there in the real world, public, how he's going to deal with that. He recently had he wanted to take the car for a car wash. And
Mhm.
he has been doing adulting things on his own, went and got his glasses adjusted all by himself, found the shop. But he couldn't understand how he was supposed to drive his tires into the tracks. He'd never
Mhm.
done it. And they were yelling at him.
Mhm. Yeah.
So and of course now he refuses, he won't go to the car wash. But so and he knows, he'll tell you, my brain takes slower to understand those things. He knows that. So now that he's 21, do you think we should have another evaluation done? Will it change anything or help him in any way?
I
That's the kind of question. Yeah.
Yeah, I think your 20s or that early adulthood, I would really call like all of 20s, honestly, early adulthood is a great time to have a follow-up evaluation, especially if the last time he did one was in middle school, because the recommendations in the evaluation might look very different from when he was in middle school. We like to give different tests, look at different skills based on what kind of developmental point they're at in their life. And so, hearing kind of those difficulties that might come up in day to day, there might be new recommendations or new treatments that a neuropsychologist might have related to those things that you brought up. Does that answer your question?
Yeah, we tried some therapy. The only thing that we did find difficult was, I mean, he talked to a couple therapists, even one and we go to Children's Hospital in Philly. They tried to push the social. He's gotten a little better with his social skills, but it was hard to find somebody who related to the rare disease aspect of it. That's where we had a problem. I could find a dozen therapists, but nobody had anything that dealt with the rare disease part of it and taking all these medicines and going to all these doctors. That's what they didn't understand.
Yeah. Yeah, and that's so important. One of the number one factors in how beneficial someone finds therapy is actually just that relationship that that patient has to their therapist or their psychologist. So if we feel that a psychologist or a therapist doesn't quite understand all those day-to-day needs, that patient might not connect as much with that therapist or that psychologist, and it might not be as beneficial. Is that something that you kind of talk to his primary care provider about and or his
Um,
medical team about? I
yeah,
wonder
we
if they have specialists kind of
we
that they
tried.
typically
Like I
recommend.
said, one of the therapists was even through Chuck where he goes, and we tried. It just we just never found. You know, he had one guy that he was talking to for a while, and it helped with some things, but then after a while it wasn't digging into some of the root of the stuff. It helped with some of the social skills and him talking to somebody other than me or his father, it helped a little bit. Now he talks more to, he has an older brother or sister, so he usually goes that way. But yeah, we just weren't successful in finding anybody that connected. So, yeah.
I'm sorry to hear that. I hope you don't give up in searching for a therapist or a psychologist that might fit for his needs. Because yeah, like you said, there might be one therapist that might be really helpful for one area, and then there's a different therapist who might be helpful for a different area.
Did anybody else have any questions? I didn't see anything. But... Who's here?
Can I ask a
Yeah,
question?
go ahead, Mona.
Hi. Thanks so much for sharing with us your information, your expertise. Um, I We're far away from children's hospitals, and so we were working with our local people and the schools. And I found it was always really helpful to explain about the challenges with myelination and how you because my child had a lot of, I mean, a lot of the behavioral components I think can be partially understood with, like, you've got raw wiring, you don't have that insulation protection. And so I would just I want your thought, I'd be curious your thoughts on that in the SDS profile, and also like that might be something that might be helpful for people who aren't at a major children's hospital to mention when they're giving that history, when they're filling out the forms. And is there anything else medically other than just the syndrome and how it affects, but things that you think would be important for parents to share with their evaluation team?
Yeah, I love that question. So I think, you know, y'all, for most of the people that y'all will be working with, y'all probably know way more about SDS than most of the medical providers or psychologists or that you'll be working with than they know about it. And certainly you are going to be the expert on your child and what they have difficulty with or what they have strengths with. So those are kind of the most important things to relay to that provider is what you know about SDS and how it affects your child, and also what you see as the biggest strengths for your child or the difficulties that they might have. I think the myelination piece is really interesting. We definitely see, myelin and how it shows up in our brain is that it helps us kind of connect our different brain connectors faster. It gets information transferred from one area of the brain to the other area of the brain really quickly. And if we don't have that myelin or that that fatty tissue that can help with speeding up that connection, then it slows down our thinking a little bit. It doesn't mean that we don't get there. It just means that it takes us a little bit longer to get there. So I think that's a really interesting point that you bring up. What I know just in general, based on, sample studies for SDS, is that there are just general broad differences in how kiddos with SDS in their brains develop. So, just general brain differences. Sometimes that shows up in brain imaging, sometimes it only shows up on a neuropsychological evaluation like we do. So, I think that's important to note is that with SDS, we have brain differences. That's an important thing to let a neuropsychologist or anyone who's doing an evaluation know. And then the other important key piece for them to know is just whether or not your kiddo has received a bone marrow transplant or not, because that does affect kind of cognitive outcomes and what we can expect for brain development. Hopefully that answers your question.
Anybody else? No?
I see a question about the difference between boy brains and girl brains. Um, I think there are different, learning points, especially because we see that puberty has such a big effect in brain development and when we hit certain milestones. And we know that girls go through puberty earlier on than boys. And so that's really the biggest difference when it comes to a developing brain for boys and for girls. The most important thing to know, though, is that if they are doing a neuropsychological evaluation, we're typically evaluating them and comparing them to the same gender that they or the same sex that they were assigned to at birth. So if you have a 12-year-old boy coming in for a neuropsychological evaluation, we're going to be comparing them to other 12-year-old boys and how they did on that testing. So that's kind of the important point that comes up for me. But yeah, the biggest difference that we see in boy brains and girl brains is just when we're hitting puberty and how that shakes out. But eventually it does all kind of shake out to be about at the same level as everybody.
And I don't know if this is true across the board for SDS kiddos, but I know that Matt was delayed in his puberty.
Okay. Yeah.
So comparing him to another 12-year-old boy might not have related either.
Absolutely. Yeah, exactly. That's
So,
such an important thing to know. Yeah. Absolutely. Very important to consider.
mm,
All right. So an ideal first time for a neuropsychological evaluation. So if he's 3, I would start asking about neuropsychological evaluations either at about 4 years old or 5 years old. So right before he's going to enter kindergarten or when he's in kindergarten is a nice time to get a first neuropsych evaluation, especially if you haven't already been connected to things like early intervention services, which sometimes people do for kiddos who are 0 to 3. It's a good idea to get a head start on that evaluation before entering school, so that that neuropsych evaluation can kind of inform the school. How does SDS affect their brain development? How is it going to affect how they do in school, and how can they best help your kiddo engage in school and perform at their best? Those are things that a neuropsych evaluation is going to help with. All right, so in terms of whether SDS patients need more sleep than the typical child, that is not something that I know the answer to. I think my initial thought is that I haven't seen anything about them needing additional sleep. Definitely ask your medical team, though, and their pediatrician. I will say that sleep is important too, based on their cognitive or developmental level. So if your kiddo is 12 years old, but developmentally we're a little bit delayed and more like in that 8-year-old range, then they might need the same level as a regular 8-year-old, as opposed to a kiddo that's their chronological age of 12, if that makes sense. So I would kind of go based on their developmental level as opposed to what's recommended for their chronological age level. Okay, perfect.
and I know you jumped on late. We are recording this, and there was some slides that you'd probably want to see on the when to test. So you can see that later. And I will just say that I do know I have 2 children from my first marriage, and then that Matt definitely did require more sleep, and not necessarily for cycle, but just because of his body, and the blood, you could tell when he needed more sleep. He still doesn't understand why he sleeps so much. So, yeah. Okay. We found that my daughter's ANC was low. She really needed more sleep again. That's what I said. We all know the raccoon eyes, right? We could always tell with the raccoon eyes that, uh-oh, here it comes. We need they need more sleep. Okay. Are you all doing research on, and if so, how many people have been tested? Tester. I don't know what you meant by that question.
So I know there is research out there that's being done with the SDS community. Like I know a while ago there was, I think the SDS Foundation actually has some really nice resources on like the ongoing research that's happening, including like the National Registry and things like that. So those kinds of studies typically do if there is any neuropsychological data, they pull in that data into those big research studies. All of the papers that have come out on the current research do have pretty small sample sizes. So about 30 people or less are included in kind of one research paper. So obviously they're always looking for more people to be involved in research and to complete those research studies. But I think y'all's foundation's website has some really good resources on how to find those studies and how to get involved.
Okay. Anybody else? Let's see. All right. Well, if anybody gets any questions, you can always email us and we'll get them to Dr. Pizer. We would like to thank you for your time and your expertise. Mary, you have anything to say there?
No, I actually posted my questions, but I would like to thank you so much, and I'm sure people will reach out after they read and see the video. Thank you so much for your time.
Thank you all so much for having me. I really appreciate it.
You got it.
Thank you. Thanks, everybody.
Thank you, everybody.
Thank you.